right, so I'm Dr. Brian Anderson. I'm a neurosurgeon. We're just getting here bright and early, Central Valley Medical Center in Nephi, Utah. It's a smaller community hospital. I started doing cases here about a year ago. I kind of grew up in this part of the state, and so it's been fun to come back and start doing cases closer to where I grew up. This morning we've got 4 surgeries. Hopefully shouldn't be too long of a day, so we'll get ready, start getting to work. I see the staff coming in, my device reps are showing up, so everybody is getting ready to go. There's a lot of moving parts on a surgery day like this. I'm one of those moving parts, but there's a lot of other people that have to be here for me to be able to do what I need to do. So I'm gonna head back, I'm gonna get changed into my hospital scrubs and head to the pre-op area where I'll be able to talk to the patients, make sure there's no concerns from the staff, and hopefully get going to a nice efficient start this morning. So we'll see you in a minute. Okay, we're ready to go. We're gonna head to pre-op and start talking to the patient, make sure everything's good to go. All right.
You've been talking smack on me outside of here?
Probably. Most likely. Oh, yeah. We're heading to talk to the first patient.
Hey.
How's it going?
Man.
You ready?
I'm ready. I am ready.
We've talked about things a lot. Any questions, concerns?
No, I think I understand what's going to happen.
Okay, perfect. We never know for sure how that lead's going to play for us. So usually the first thing I try to start it, assume it's going to be easy, and if it's not, then we escalate from there. So I'll probably just kind of expose that one lead and place a stylet back inside of it. If it advances on its own and lets us do that, then that's what we'll do. We'll just slide it right back up where it belongs, and that'll be it. Well, we'll get in there, we'll get it done, get you healed up, get you home.
Okay.
Okay, sounds good. Okay, getting the ORs all set up. Like I said, there's a big team involved, and so everybody's got their part, everybody's got their role. So you'll get a chance to see how that works. I think anesthesia's finishing up their work with the patient, and he'll be rolling back here shortly. So our first case is a spinal cord stimulator revision. So neuromodulation is a big part of my practice. It's what I do. Neuromodulation involves kind of implanting small computers in people placed within the central nervous system to help manage different conditions, different pathologies. For me, a lot of that's going to come down to pain. So a lot of my patients today are spinal cord stimulator type patients where we're treating pain. So for this first patient, he had a system placed. It was working really, really well for him. One of the electrodes or one of the wires that was placed migrated a bit. And if it migrates enough, then it loses its ability to treat his pain. And so we just need to go in and kind of replace that back where it belongs. He had over 90% pain relief, and so we want to make sure we can recapture that for him long term. Made a big difference in his life. We're here with Alicia, who's the OR manager. She's the boss down here. So anything that goes on, fortunately, I don't have to deal with all of it. She's going to take care of it. So we actually did have one cancellation. A patient got sick over the weekend, and we had to remove them from the schedule, but that's okay because we still got multiple other cases, so everything else looks good.
Yep, so we've got 2 other stimulator trials today. We've had this stimulator revision and then a laminotomy and microdiscectomy at the end.
Okay, perfect. Yeah. So still for 4 cases, no concerns, reps are here.
Staff's ready to go, we're all prepped and ready.
Okay, excellent. Let me know if something changes.
Sounds good.
These cases use a lot of x-ray, a lot of fluoroscopy and stuff to place and guide these wires. And so I oftentimes, or I always, pretty much have to wear lead for these types of cases. So it's kind of heavy, gets old, makes me hot, makes for a long day sometimes, but helps keep me safe and protected, so that's what we do. So it looks like everybody's ready to go. Team's kind of getting pulled together. The OR is kind of a nice, complicated, but hopefully simple choreographed dance. Everybody kind of plays their part, everybody has their role, and so you'll get a chance to see a lot of that in action. Everybody kind of needs to be on their A game for a case like this. I oftentimes think it's, I kind of forget what it's like to not know what this environment feels like. But for most people, it's a very foreign place. And so sometimes when you see what goes on in there, it almost seems too simple. Maybe it seems like people are having too much fun and that it should be super serious and scary all the time. But obviously this is a job. And just like if you're a banker or a mechanic or a school teacher or anything else, you have your normal and you have your routine days. And for the people in this room, this is a routine day. And they have a good time. They seem like they're not nervous because they're not. They do this every day. And they're not very concerned about what's going on because they know as long as everybody does their job, things go nice and smooth. Looks like they've got things about ready. We'll get ready to get started. Probably going to be replacing the one lead, and that's it. Everything else will stay in there. We'll just put it back together. New lead, new anchor, most likely, and trot a needle. Okay, so in the OR, there's a lot of people involved, like I mentioned. So we have, of course, we have anesthesia. It's going to keep the patient asleep, keep them comfortable, keep them safe, keep all their vital signs nice and stable for us. My assistant, Josh, nurse practitioner, who's going to help me, assist me during the case. We're going to have our rad techs who are going to be running our fluoroscopy machines. It's a very, very important part of this case in particular. We're going to have our OR circulator. We're going to keep everything flowing exactly right. Anything we need or don't have in the room, they're going to run and grab it. They're just going to basically do everything, charting everything, make sure everything happens smoothly. We're going to have our scrubs. We're going to be running this case, making sure I have everything I need. Don't even hardly have to ask for it. Most of the time they anticipate what I need. We have our device rep for this case that we're gonna need their support because we're implanting things in patients. So they're gonna get us everything that we need. So you'll see all this stuff happening kind of fluidly throughout the case, and that's what allows us to do this over and over and very safely and predictably. We're good to go. It's time to begin. Okay, perfect. Okay, so we're done with our first case. Everything went well. Ended up having to do a little more hardware replacement than we expected, but expected's a big word because you never know what you're going to come into. Patient will come here into PACU as soon as they roll out. But I'm going to go talk to the family real quick and let them know how things went. So all done, obviously. Everything went fine. No big surprises. There was one impedance this morning. Each one of those contacts we do a little diagnostics on, and one of the impedances was off from what it normally is. Doesn't really affect how it works, but sometimes can be an issue with MRI compatibility and things like that. So ironically enough, it was not the migrated lead. We assumed that it would be the migrated lead that had the impedance that was out, but it wasn't. It was actually the other lead. So, yeah, it's good. Okay, excellent. We'll see you again in a little bit. All right, one of my favorite things about operating in a smaller hospital is that you get to see everyone who makes this all happen. And so one of the administrators, big boss, right, has been graciously enough to help me get started up here. And so Randy happened to be down here, and so we decided we'd grab him and see how he's doing today, see if there's anything I need to be doing differently.
We're grateful to have Dr. Anderson here. He does a great job for us. I'm from a small town, Dr. Anderson's from a small town. We want to keep people close to home so they don't have to travel, and they can be here locally and take care of their needs, which is great.
Yeah, it's big. Again, it's a big load. Healthcare is getting more and more complicated, and so for these types of facilities to be able to flourish in today's world is not easy. So I think it speaks to their leadership and what they've been able to do. So I'm grateful. Anything I need to do to change or anything I can do to help?
Great job, and we're happy you're here.
Okay, excellent. Thanks so much. Appreciate it. Have a good day.